In previous lecture, we started next unit in pharmacology and toxicology is autocoids, in which autocoid means these are the local hormones and they are produced in tissue. Also, they synthesize and release in local tissue or local site. That's why they are known as autocoids. Then autocoids, they shows intense biological action as well as they are responsible for pain, itching, and inflammation. Then their classification, they are classified into three types: amines derivative, peptide derivatives, lipid derivatives. In which amines derivative, their examples. What are the
Histamine.
examples of amine derivative?
Histamine.
Histamine 5-hydro.
Drugs.
Histamine and 5-HT, that is serotonin. Then peptide derivatives, example. Screen is visible to all.
Bradykinin.
Yes, ma'am.
Bradykinin.
Angiostensin.
Bradykinin, angiotensin, and caladine. Then lipid
Caladine.
derivatives, examples.
Prostaglandin. Leucotronin.
Prostaglandin.
Platelets. Activity
Prostaglandins,
factors.
leukotriene, platelets, activating
Platelets.
factor, PAF, PGS, LTS. So this is classification in which we have to study in detail about pharmacology of histamine and prostaglandin from lipid derivatives. So in previous lecture, we discussed up to pharmacology of histamine, in which histamine produces flash, flare, and wave. Histamine, it is a tissue or biogenic amine which having which ring?
Triple
It having
response.
imidazoline ring. It is so histamine, it is an imidazoline compound and which is widely distributed into the body, and it is present in platelet, leukocytes, basophils, mast cells, and in various biological fluids. And the highest concentration of histamine which is present in lungs and skin. After that, we discuss different types of receptor, in which H1, H2, H3, and recently discovered receptor is H4, in which important point is location and their effect. So which receptor present in parietal cell? H1, H2, or H3?
H2.
H2, it is present in gastric parietal cell. So which receptor is responsible to increase the gastric acid secretion?
H2.
H2 receptor. Okay. Then which of the following receptor shows sedation effect? H1, H2, or H3? Sedation effect.
H3.
H3.
H3, because H3 receptor mostly found in CNS. That's why they show effect on CNS is sedation. Then location of H1 receptor.
Throughout the body, specified
Throughout the body,
was on the
special
endocrine cell in the heart and the CNS.
And effect is it increases vascular permeability and also increases mucus secretion. Then H2 receptor, they are present in parietal cells or gastric parietal cells, and they increases the gastric acid secretion and their release. Then H3 receptor, they are mostly present in brain, CNS, or thalamus, and they shows effects such as sedation or neural presynaptic receptor, which may releases the function of histamine and which produces sedation effect. After that, we discuss synthesis. How histamine is synthesized? In presence of which enzyme?
Histidine.
So histamine, it is synthesized from histidine in presence of enzyme L-histidine decarboxylase. So this is about general information of histamine. The next point is pharmacological actions of histamine, in which first one is on blood vessel. What happened? Which effect observed on small blood vessel?
Vasodilation.
Vasodilation.
So on the small blood vessel, it produces vasodilation, and on large blood vessel, it produces vasoconstriction, that is increase in DP. Then next on skin, it produces itching and pain sensation. On smooth muscle, which effect is observed? Which pharmacological action is shown by histamine on smooth muscles of bronchi,
Contraction of
intestine,
uterine
and
and bronchial
uterine?
muscles.
That is constriction or contraction of all the muscle, uterine constriction, bronchoconstriction, and intestinal constriction. Then which effect observed on gastric gland?
Increase gastric secretion.
Okay.
It increases GI secretion. On sensory nerve ending, histamine causes
pain.
This pain.
pain. Then next, action on autonomous ganglion and adrenal medulla. What happens?
Increase force of
Increase
contraction.
and also force of contraction.
Because of there is increased synthesis and release of adrenaline from adrenal medulla, and therefore it increases heart rate as well as increases force of contraction. And last one is action on CNS. It does not crosses blood-brain barrier, and if it is given through intracerebroventricular injection, then it increases BP. So this is about pharmacological actions of histamine. Then on H2 receptor, it shows positive inotropic and positive chronotropic effect. What is mean by positive inotropic effect?
Increase force of contraction.
Force of contraction.
Then inotropic means, chronotropic means
Heart rate.
Heart rate.
roll number 66. Are you present? Sound is audible to all.
Yes, ma'am.
Yes,
Yes.
ma'am.
Okay, roll number 66. Are you present? 65.
Yes, ma'am.
What is mean by chronotropic and inotropic? 66. Chronotropic effect means roll number 66. Are you present?
Yes, ma'am.
Then answer it. What is mean by chronotropic and inotropic? $65. Roll number 65. Are you present? If you are not responding, then it will be considered as absent. Anyone? What is chronotropic and inotropic effect?
Increase in heart rate.
Increase heart rate and
Inotropic increase in force of contraction.
Increase force of contraction.
Now roll number 66. What is mean by inotropic and chronotropic effect? Roll number 66. Don't waste time. What is mean by chronotropic and what is mean by inotropic effect? हे फक्त स्लाइड वर दिसतंय. ओके, H2 रिसेप्टर पॉझिटिव्ह chronotropic, पॉझिटिव्ह inotropic. काय आहे meaning? 65 absent आहेत. 64 are you present?
Yes, ma'am.
What is mean by chronotropic and inotropic? Any idea? Yes or no? Munde.
Yes, madam.
काय आहे inotropic? माहिती आहे? माहिती आहे की नाही? Yes or no? माहिती आहे हेच माहित नाही. $63 are you present?
Yes, ma'am.
What is mean by chronotropic and what is mean by inotropic?
Nootropics means
माहित नाही. 62, 61. Roll number 61 and 59. Are you present?
Yes, yes, madam.
What is mean by chronotropic
Change the
and
heart rate
inotropic?
and rhythm, and inotropic change the force of contraction of hearts.
Change. Okay, very good. Roll number 58,
Yes, ma'am.
57, 58. Roll number 57 and 58 present आहेत. Sound is audible to all.
Yes, sir.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, 65, 58 and 57 absent. 55 roll number. Hake Atharva, are you present? $56.
Yes, ma'am.
What is mean by chronotropic and inotropic?
Chromotropic is the change of heart rate, and inotropic is change of force of inotropic change the force of heart contraction.
Change.
Change.
Remaining students, correct है कहे? Is it right?
No, ma'am.
No, ma'am.
Roll number 46, 47. Are you present? $46 and 47. Sound is audible to all.
Yes,
Yes.
ma'am.
Yes, ma'am.
48, 46, 47.
Yes, ma'am.
What is mean by chronotropic and what is mean by inotropic?
Chronotropic drugs may change the heart rate, rhythm, affecting the electrical system of the heart, that influence it, produced by senoatrial node.
काय सांगताय काय बघून रेट करताय? What is mean by inotropic? $47. Are you present? Roll number 47.
And
What is mean by inotropic?
inotropic change the force of your heart's contractions.
46. 47 तुम्ही सांगा. Inotropic and chronotropic. 48, 49.
Yes. Increasing the force of contraction means positive inotropic and change in heart rate means chronotropic effect.
Repeat again, 49.
Increasing force of contraction means positive inotropic and change in heartbeat means chronotropic effect.
And what is mean by inotropic? Positive inotropic.
Increasing force of contraction.
So positive inotropic and positive chronotropic effect is observed on histamine H2 receptor. Positive inotropic means increase in force of contraction and chronotropic means heart rate increase होतं. And chronotropic, only chronotropic it is related to heart rate and inotropic it is related to force of contraction. Then pharmacokinetic, it is orally active or inactive?
Inactive.
Then preparations, histamine acid phosphate IP 1 mg per ml, it is given by subcutaneously. It is given by subcutaneously. Why it is not given by orally?
Because it is inactive orally.
Because they are orally inactive and totally degraded into the liver. Question विचारल्यावर left व्हायचं and after that question संपला की join व्हायचं. Then next point, contraindication. In which condition histamine is contraindicated?
Antiasthma आणि ulcer patient मध्ये.
Antiasthma and
Ulcer patient मध्ये.
slide वर काय दिसते? Asthmatic दिसते की anti-asthmatic?
Asthmatic and ulcer patient.
In asthmatic patient and in ulcer patient, then it is used in
Gastric secretion.
to study the gastric secretion and second diagnosis of phenochromocystoma. What is mean by phenochromocystoma? It is small tumor to the adrenal gland. It is known as phenochromocystoma. The diagnosis of this disorder, histamine is used. Up to this, सगळे point clear आहेत?
Yes, ma'am.
Yes, ma'am.
Okay, then next point in this unit is antihistaminic agent. These are the pharmacological agents or drugs or other compounds that inhibit the physiological effect of histamine and used especially in treatment of allergies is known as antihistaminic agent. Histamine काय produce करतं? Histamine is responsible for or it produces histamine produces itching, inflammation and pain. ते जे इफेक्ट आहेत त्यांना antihistaminic agent inhibit करणार आहे. So physiological effect of histamine is inhibited by antihistaminic agent and they are used in treatment of allergies is known as antihistaminic agents. These are the pharmacological agents, drugs or substances or compounds that inhibit physiological effect of histamine. Histamine चे जे effect आहेत, this effect, histamine causes pain, then gastric secretion, then it produces itching sensation, inflammation. This all this effect inhibited by antihistaminic agent. Sound is audible to all?
Yes, ma'am.
And also they are used in treatment of allergies. Certain type of allergic condition is known as antihistaminic agent, or another definition is these are the pharmacological agent when they are administered externally, then they antagonize. Antagonize means to promote or to stop. Antagonize the effect. Antagonism काय करतात? Antagonist To promote effect or to stop the effect. One substance stop the action of another substance is known as antagonist. Is it right or wrong?
Right.
Then
Right.
antagonize antihistaminic antagonize effect of histamine. म्हणजे काय करतील हिस्टामाइनचे इफेक्टला प्रमोट करतील की प्रिव्हेंट करतील.
Prevent.
Prevent करते.
अँटी मीन्स प्रिव्हेंट. ऑल आर प्रेझेंट. लक्ष आहे सगळ्यांचं.
Yes, ma'am.
Yes,
Yes, ma'am.
ओके. सो अँटीहिस्टामिनिक ड्रग्स हे हिस्टामाइनचे जे इफेक्ट आहेत म्हणजे H1 H2 रिसेप्टरचे त्यांना अँटागोनाइज करतात. सो दीज आर दी फार्माकोलॉजिकल एजंट्स when they administered externally, then they antagonize effect of histamine on H1 H2 or H3 receptor. तर receptor वर असलेला इफेक्ट antagonize करतात. These agents are known as antihistaminic agent. Then their classification. Definition समजली आहे? Do you understand
Yes, ma'am.
definition?
Yes, ma'am.
yes,
Yes,
ma'am.
Yes, ma'am.
Then next point is classification. It is classified into two classes, H1 receptor antagonist. Agonist, antagonist आहे का लक्षात? What is mean by agonist? की first time ऐकले antagonist, agonist. Agonist, antagonist, this concept we are already studied in first unit. Do you remember?
Yes, ma'am.
Yes,
Tell me
ma'am.
definition of agonist, काय असतात agonist, antagonist. Can anyone tell the definition of agonist, antagonist?
Agonist means the drug that
The
bind the
drug.
receptor.
Means binding capacity of drug to receptor is known as agonist. Antagonist means to oppose action or to prevent the action. So antihistaminic agent act as to prevent the action of histamine. That's why the histamine act on this H1, H2 and H3 receptor on their action. This action is inhibited or prevented by antihistaminic agent and their examples are diphenhydramine, promethazine, chlorcyclazine or meperamine. So these agents act by their action particular either on H1 receptor or H2 receptor. So different antihistaminic agent they act on H1 receptor and here they inhibit the action of this histamine on H1 receptor and H2 receptor antagonist. These are the agent act as antihistaminic agent and to inhibit the action of histamine on H2 receptor. So this agent is known as H2 receptor antagonist. So let's see first class antihistaminic is classified into two classes in which first one is H1 receptor antagonist. So what we can say, what is definition of H1 receptor antagonist? Can anyone tell the definition? काय असेल definition H1 receptor antagonist ची? From their name, class जे नाव आहे त्याच्यावरून 49. What we can say, what is definition of H1 receptor antagonist? Sound is audible to all?
Block the effects of histamine.
So these are the pharmacological agent. They competitively block the effect of histamine, which is mediated through which receptor?
H1 receptor.
H1 receptor antagonist. So definition of H1 receptor antagonist is these are the agent or pharmacological agent which competitively block the effect of histamine, which is mediated through H1 receptor, is known as H1 receptor antagonist. Then it is classified into again subclassified into three classes in which first one is potent and sedative. Their examples कोणते examples?
Diaphragm.
Diphenhydramine and promethazine are the examples of potent and sedative. Then second class, potent
Potent but
but
less
less sedative. Then their
Less sedative.
examples. Second class examples.
chlorosylizine.
Chlorpheniramine and chlorcyclazine. Then third class, less potent and less sedative. Their examples, chlorpheniramine and mepyramine. How many classes in H1 receptor antagonist?
3 classes.
First one is
Potent and
Potent and sedative.
potent and sedative. Their example, diphenhydramine. Then second,
Promethazine.
Potent and sedative.
Potent but less sedative.
Diphenhydramine. Potent
potent
but
but
less
less sedative.
Pyramide.
Roll number 23. Read the classification.
pH receptor antagonist. There are three classes: potent and sedative. Example: diphenhydramine, hydrazamine. Second,
Diphenhydramine.
diphenhydramine. Second example, promethazine. Second class, potent but less sedative. Example: chlorosylizine, chlorpheniramine. Third number class, less potent, less sedative. Example: mepyramine and chlorpheniramine.
Okay, then next second class is H2 receptor antagonist, that is cimetidine, ranitidine and burimamide. Cimetidine, ranitidine tablet, त्याचे preparations माहिती आहेत? Why they are used? In which condition ranitidine, rantac tablet is used?
acidic
Acidity.
condition.
So here same function of this histamine, it increases the histamine काय करतो acid secretion increase करतो. Then H2 receptor antagonist द्यायचे to reduce this increased secretion. That's why their examples are ranitidine and cimetidine, burimamide. Classification समजलंय antihistaminic चं?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
How many classes?
2 classes.
2 classes.
Mainly two.
Two
Then
classes.
first class is again divided into
3 classes.
three types.
Three.
Okay, then next point is pharmacology of this antihistaminic agent, म्हणजे means in which how they act. Okay, triple response कौन produce करता है? Triple response is
Histamine.
produced by
Histamine.
histamine. Triple response produce करतो. So this triple response is inhibited by antihistaminic agent. Antihistaminic agent चं function काय आहे किंवा what they do? They inhibit the physiological effect of histamine. That is first one. Antihistaminic agent block the triple response. Roll number 10. 11. Are you present?
Yes, ma'am.
Roll number 10. Read the pharmacology of antihistaminic agent.
Antihistaminic block triple response of histamine. Second, these agent antagonize stimulate action of histamine on smooth muscle of GIT. Third, this agent inhibit histamine induced salivary secretion. Fourth, this antagonize histamine induced bronchospasm. For fifth, they possess local anesthetic effect.
What is mean by local anesthetic? Local anesthetic effect. काय असतो? What is mean by local anesthetic? Sound is audible to all?
Yes, ma'am.
Yes.
Okay, let's see one by one pharmacology of antihistaminic agent. Firstly, antihistaminic block the triple response of histamine. कोणता triple response है? Clash, flare, and
Clash,
wheel. This triple response is
flare,
inhibited by
and wheel.
antihistaminic agent. Then next, this agent antagonize stimulant action of histamine on smooth muscle of GIT. Histamine ची जी stimulatory action आहे GIT च्या smooth muscles वरती, ती action antihistaminic agent antagonize करतात, means stop किंवा prevent करतात. Then next is this agent inhibit histamine induced salivary secretion, means histamine जे salivary secretion produce करते, that also inhibited by this antihistaminic agent. The next point, they antagonize histamine induced bronchospasm, म्हणजे constriction होत होतं, that is bronchospasm means bronchial spasm. There is sudden constriction of muscle in the walls of bronchioles. So this also inhibited by or antagonized by antihistaminic agent. They possess local anesthetic effect. Local anesthetic effect means, what is meant by local anesthetic?
Loss of consciousness without affecting by loss of consciousness.
Okay, so this antihistaminic they produces sedation. Sedation effect म्हणलेलं H3 receptor वर. Yes or no?
Yes.
Yes, ma'am.
So you have to write same point. They possess local anesthetic effect. So this is about pharmacology of antihistaminic agent, means how they act by actions of histamine. म्हणजे हिस्टामाइनच्या all the actions antihistaminic agent block करतात. Then next point, pharmacokinetic. Rule number 11. Read the pharmacokinetic of antihistaminic.
Pharmacokinetics. Antihistamines are well absorbed orally as well as parentally. These are the metabolized in the liver. Degradation products are eliminated in urine.
Okay, define pharmacokinetic.
Pharmacokinetic is a branch of pharmacology in which what mechanism of action of drug.
Is it right?
डायनेमिक झाली ती.
फक्त 23 यांना समजले की डेफिनेशन चुकीची होती, बाकीचे सेम बरोबर आहे.
No, ma'am. No, ma'am. These are the pharmacological agents study of ADM.
Absorption, distribution, metabolism, excretion of the body.
Okay, so pharmacokinetic, it is study of ADME in which antihistaminic are well absorbed orally as well as parentally. They are metabolized in liver and degradation product are eliminated, means after metabolism जे product degrade झालेले आहेत, that they are eliminated in the form of urine. Elimination means another term for elimination.
Remove.
Excretion. Excretion. So this is pharmacokinetic of antihistaminic agent. Okay, atropine ची category सांगताय कोण? Can anyone tell the category of atropine? Sound is audible to all.
Parasympathetic.
Parasympathetic and anticholinergic agent.
Okay. So antihistaminic agent shows pharmacological actions resembling to atropine. हे antihistaminic agent pharmacological action atropine सारखा दाखवतात. Then dryness of mouth हे झालं atropine मध्ये secretion reduce करतात. Atropine produces dryness of mouth. झाले का हे? आठवतो का anticholinergic? Drugs acting on ANS or CNS, atropine?
ANS.
ANS.
Atropine ची pharmacology आठवते? Yes or no? ड्रायनेस ऑफ माउथ हा इफेक्ट झालाय की नाही त्याच्यामध्ये?
Yes, ma'am.
ब्लड विजन, ड्रायनेस ऑफ माउथ, अट्रोपिनच्या पॉइझनिंग मध्ये लिहिलंय का तुम्ही? येस और नो? atropine poisoning, then when antihistaminic shows same pharmacological action like atropine, सेम म्हटल्यावर दोन्हीचे सेम येतील की नाही?
Yes, ma'am.
आणि एका रिझन मध्ये आपण बघितलेलं की सिक्रिशन atropine रिड्यूस करतात. मग सिक्रिशन सलायवरी सिक्रिशन रिड्यूस झाल्यावर काय इफेक्ट प्रोड्यूस होईल? which effect is observed?
Dryness of mouth.
Dryness of mouth.
हा, मग साइड इफेक्ट मध्ये लिहिलंय की नाही atropinच्या?
Yes, ma'am.
So you have to write same side effect: dryness of mouth, blurred vision or blurring of vision, sense of tightness in chest, then fatigue and sedation. So these are the side effects of antihistaminic agent. Roll number 34. Are you present?
Yes, ma'am.
Side effects of antihistaminic agent. Roll number 34. Tell me the side effects of antihistaminic agent.
Dryness of mouth, sedation, sense of tightness in chest, then blurring of vision.
Sedation, fatigue, dryness of mouth, blurred vision, and sense of tightness in chest. So these are the side effects of antihistaminic agent. Antihistaminic agent having same pharmacological action as that of atropine. Also, antihistaminic agent prevent triple response as well as they prevent vomiting. Then next point, therapeutic uses of antihistaminic agent. Roll number 53. Are you present? '53. Sound is audible to all?
Yes, ma'am.
Roll number 53.
Yes, madam.
Read the therapeutic uses.
Therapeutic uses to treat allergic disorders like urticaria, rhinitis, cough, as local anesthetics to produce hypothermic during surgery, to treat motion sickness.
Roll number 5. Are you present?
Yes, ma'am.
Read the therapeutic uses of antihistaminic agent.
To treat allergic disorder like urticaria, rhinitis, cough as local anesthetic, to produce hypothermia during surgery, to treat motion sickness.
Sound is audible to all?
Yes, ma'am.
Yes, ma'am.
व्हॉट्सअप तुमच्या व्हॉट्सअप ग्रुपवरती एक फॉर्म सेंड केलाय मी, गुगल फॉर्म. बघितलाय का? येस और नो?
जर बघितला असेल फॉर्म ओपन करा, तुम्हाला 10 मिनिटे टाइम दिला जाईल. 10 मिनिटांमध्ये तुम्ही तो फॉर्म ओपन करा.
Uses of antihistaminic agent or H1 receptor antagonist, in which first one is to treat allergic disorders like urticaria, rhinitis, and cough. Urticaria means there is rash round or red colored round observed on the skin, red spot observed on the skin, that is urticaria. Sometimes there is dangerous swelling condition on the skin, is known as urticaria, and it is happened due to allergy. Then next, cough माहिती आहे. Then rhinitis. Rhinitis means there is inflammation to nose. So to treat these allergic disorders, these antihistaminic agents are used. Then second, it is used as a local anesthetic. Antihistaminic agent produces sedation effect that is without affecting on the loss of consciousness. They shows loss of sensation in the local area, so it acts as local anesthetic agent. Then next, it is used to produce hypothermia during surgery. What is mean by hypothermia? Any idea?
Decrease body temperature.
Okay, so low body temperature to produce decreased or reduced body temperature during the surgery. These antihistaminic agents are used. Then last one is to treat the motion sickness. Antihistaminic agents used to treat the motion sickness. Motion sickness means nausea. So nausea, it is caused by especially during the traveling. This motion sickness or nausea is caused due to the motion. So to treat this all the disorder, antihistaminic agents are used. समजले the uses?
Yes, ma'am.
In which condition these agents are used? हे समजलंय?
Yes, ma'am.
Therapeutic
Yes, ma'am.
uses of antihistaminic agent.
Yes, ma'am.
Okay, then next point, preparations. Diphenhydramine, trade name, brand name or trade
Benad.
name. Guys,
Benadryl.
equal to all.
Yes, ma'am.
Yes, ma'am.
Yes.
Diphenhydramine. It is from the first category, H1 receptor antagonist, in which potent and sedative. So their trade name is Benadryl and their dose is 50 mg. Then second drug, mepyramine malate. Their dose
50 mg oral.
स्क्रीन दिसत असेल तर रीड करू शकता. Screen is visible to all.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Mepyramine maleate. What is trade name?
Antisun.
Antisun. Their dose
50 mg orally.
PMG orally.
PMG oral.
त्यांना येत नाही त्यांनी काय केलं तरी चालेल. Then their dose 50 mg oral. Then next drug, pheneramine maleate. Trade name
Avil.
Avil. Then their dose
25 mg oral.
25 mg given by oral route. Then last one is chlorpheniramine maleate. Their trade name ZID. And dose is 5 to 20 mg.
20 mg oral.
Preparation of antihistaminic agent. Here we complete antihistaminic agent means from Autocoid. From their classification, we get their example from amine derivatives is histamine. So we discuss in detail about histamine, their introduction, synthesis, receptor, then their actions, pharmacological actions, pharmacokinetic contraindications and uses. And to stop the action of this histamine, pharmacological actions, the agent used to inhibit this action is known as antihistaminic agent, in which we discuss their definition, their classification, pharmacology of antihistaminic agent, pharmacokinetic, side effect, and their therapeutic uses. And last point is preparation. Here we complete histamine as an amine derivative which acts as autocoid. It is a tissue amine or biogenic amine. समजला इथपर्यंत?
Yes, ma'am.
Yes, ma'am.
Okay, then next autocoid. Which autocoid we have to study in detail? Next कोणता करायचा आहे?
Prostaglandin.
Prostaglandin. From which class? Lipid derivatives. Another name for lipid derivative? Another name? Eicosanoids derivatives. Their examples is prostaglandin, leukotrienes, and platelet activating factor. So let's see the next point in this unit is prostaglandin. Can anyone tell the synthesis of prostaglandin from NSAID chapter? NSAID मध्ये prostaglandinचं synthesis बघितलेलं, right?
Yes, ma'am.
Yes, ma'am.
How it is synthesized? प्रीवियस लेक्चर मध्ये सांगितलेलं NSAID मधलं सिंथेसिस रीड करा, लुकआउट करा. Yes or no?
Yes, ma'am.
You don't have sufficient time to go back and read this chart. सांगतेत मॅडम कशाला रीड करायची? Out of 66 students, can anyone tell synthesis of prostaglandin? Chart आठवतोय? झाले की नाही हा पॉइंट? Yes or no?
Yes, ma'am.
Yes, ma'am.
जे झालंय तेही येत नाही. ही स्लाइड दाखवलेली अगोदर?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
इथं ब्लॉकची ऍक्शन होती NSAID मध्ये, राईट?
Yes, ma'am.
So let's see the lipid derivative or eicosanoids in which their example is prostaglandin. So firstly, the substance it is extracted from the seminal fluid is known as prostaglandin. कुठून extract केला जातो? From which fluid?
Seminal fluid.
Seminal fluid. Van Leer in 1935 discovered an isolated prostaglandin from human seminal fluid. And the substance which is extracted from seminal fluid is known as prostaglandin. Then next, okay, derivatives of prostaglandins are closely related to cyclic compound 20 carbon unsaturated fatty acid, which is named as prostanoic acid. It is involved in the composition of prostaglandin. Which acid? Prostanoic acid. 20 carbon containing unsaturated fatty acid, which is named as prostanoic acid. It is in the composition of prostaglandin. It is synthesized from arachidonic acid. बरोबर है? Phospholipid from arachidonic acid in presence of enzyme. Which enzyme?
Cyclooxygenase.
Which is converted into prostaglandin. So this prostaglandin, it is synthesized from arachidonic acid by their action of prostaglandin synthetase, which is widely distributed into the body in prostate, seminal vesicles, liver, kidney, then pancreas. Means त्याची ऍक्शन होल बॉडी मध्ये डिस्ट्रीब्यूट झालेली असते, इन विच seminal vesicles, liver, kidney, prostate, and pancreas. On the basis of their chemical structure, prostaglandin can be classified into 6 groups, in which A, B, C, D, E, F. Out of these, PGE2 and PGF2 are used in therapeutics. Means from their chemical structure, they are classified into how many groups? आपल्याला chemical structure बघायचं नाही. It is in the chemistry, pharmaceutical chemistry. We have to just know there are 6 groups, and out of these 6 groups, PGE2 and PGF2, they are used in therapeutics. Means they pharmacology मध्ये आपल्याला study करायचे आहेत. Which action is produced on this group? Sound is audible to all?
Yes, ma'am.
So from their chemical structure, it is classified into how many groups?
6 groups.
6 groups.
A, B, C, D, E, F. And out of this, PGE2 and PGF2, they are used in therapeutics. So next point is synthesis of prostaglandin, in which firstly phospholipid, membrane phospholipid, in presence of which enzyme it is converted into arachidonic acid?
Phospholipase.
So membrane phospholipid in presence of phospholipase A2 enzyme, it is converted into arachidonic acid, and this phospholipase A2, it is stimulated by chemical stimuli as well as mechanical stimuli, in which arachidonic acid, which is converted into prostaglandin, or prostaglandin, it is synthesized from this arachidonic acid in presence of cyclooxygenase enzyme, that is COX enzyme. So we have to remember only this pathway. Then this next, हे सगळे लिपिड डेरिव्हेटिव्ह आहेत. हे सिंथेसिस जरी लक्षात ठेवलं तरी ऑल थ्रोम्बोक्सेन, ल्युकोट्राइन्स कशामध्ये येतात? हे कोणत्या डेरिव्हेटिव्ह अंडर आहेत? फ्रॉम ऑटोकॉइड क्लासिफिकेशन
Lipid.
आहेत का लिपिड डेरिव्हेटिव्ह मध्ये तिन्ही? Thromboxane means platelet activating factor. So all these synthesized from arachidonic acid in presence of different enzyme. So in presence of cyclooxygenase enzyme, arachidonic acid gives thromboxane and prostaglandin, and in presence of lipooxygenase enzyme, they use leukotrienes. समजले synthesis?
Yes, ma'am.
Okay, prostaglandin, it is synthesized from which fluid?
Animal fluid.
Seminal fluid.
Which fluid?
Seminal fluid.
Seminal fluid. Then next point. समजते का काय पॉइंट सुरू आहे आपला?
Yes, ma'am.
Yes, ma'am.
ऑटोकॉइड मध्ये जे क्लासिफिकेशन आहेत त्या क्लासिफिकेशन मधला फर्स्ट अमाइन डेरिव्हेटिव्ह मधला हिस्टामाइन आणि अँटीहिस्टामाइन स्टडी केलाय. आफ्टर दॅट सेकंड क्लास जो आहे, कोणता सेकंड क्लास? अमाइन, लिपिड अँड ओके. सो लिपिड डेरिव्हेटिव्ह मध्ये प्रोस्टाग्लॅंडिन अँड रिमेनिंग 2 एक्झाम्पल जे आहेत त्याच्यामधला आपण प्रोस्टाग्लॅंडिन इन डिटेल बघतोय. बरोबर आहे?
Yes, ma'am.
Derivative.
Then let's see the next point in the prostaglandin. Physiological role. Physiological role of prostaglandin. Role number 2. Are you present?
Yes, ma'am.
Read the physiological role of prostaglandin.
First one, it is vital role in reproductive physiology. Second, it is vital role in gastric secretion. Third, maintain smooth
Its
muscle.
vital role.
Third, maintain smooth muscle, spontaneous tone. Fourth, in females, responsible for uterine and fallopian tube contractility. Fifth, in males, it is involved in erection, ejaculation, sperm motility, and steroidogenesis.
Okay, so physiological role of prostaglandin, in which first one is its vital role in important role in reproductive physiology, means reproductive system जे आहे त्याच्या functions च्या related याचा role आहे. Then next point, its important role in gastric secretion. Then third point, it maintains smooth muscle spontaneous tone. Smooth muscle चा जो tone आहे, contraction relaxation, ते prostaglandin maintain करतात. Then next point, in female, this prostaglandin responsible for uterine and fallopian tube contractility. Uterine and fallopian tubes, माहिती आहे? You are already studied in female reproductive system. These are the parts of female reproductive system. So contractility of this uterine and fallopian tube is maintained, or for their contractility, prostaglandins are responsible. Then next point, in males, sound is audible to all?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
The next and last physiological role of prostaglandin in males, it is involved in erection, ejaculation, sperm motility, and steroidogenesis. Here, steroidogenesis means there is synthesis of steroidal hormone from cholesterol. Then sperm motility means ability of sperm to swim into the right way, that is sperm motility, that is movement of sperm. Then next is ejaculation. Ejaculation means ejecting the semen from the body, that is ejaculation. Then next one is erection. Erection, in which enlargement or rigid state of penis. So all these roles are related to reproductive physiology or reproductive system of male and female. So in the females, it is responsible for contractility. In the male, it involved in erection, ejaculation, sperm motility, and steroidogenesis processes. It also maintains smooth muscle spontaneous tone, and also its important role in gastric secretion. So this is about physiological role. Then next point, pharmacological actions. Synthesis, general introduction, and physiological role. समजले?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
The next point, pharmacological actions. So in the pharmacological action, first action on CVS. So PGE2 and PGF2, the therapeutic uses मध्ये important आहे. So on the PGE2 and PGF2, it produces peripheral vasodilation effect. Vasodilation effect असल्यावर BP rise होईल की fall होईल?
Fall.
All okay.
So on the CVS, it produces peripheral vasodilation and there is fall in BP. Then next, on bronchi. On PGE2, it produces bronchodilation effect, and on PGF2, it produces bronchoconstriction effect. PGE2 वरती कोणता इफेक्ट आहे? ब्रोंकोडायलेशन. PGE2, PGF2 काय हे समजतंय? इथे जे मेन क्लासेस आहेत प्रोस्टाग्लॅंडिनचे PGI2, H2, T2, E2. Okay, so these are the 6 groups from their chemical structure. So त्याच्यामध्ये PGF2 वरती bronchoconstriction and PGE2 bronchodilation effect. CVS वरती कोणता आहे? Which pharmacological action observed on CVS?
Vasodilation.
Then what happened?
Fall in BP.
Roll number 63, are you present? 63. 65.
Peripheral vasodilation.
Sound is audible to all.
Yes, ma'am.
Yes, ma'am.
Roll number 63, 65. Are you present? Okay, 65. On CVS. CVS means CVS काय? Naikwadi Akash. What is mean by CVS? Sound is audible to all.
Yes, ma'am.
65.
Yes, ma'am.
Are you present? 63
Yes,
and
ma'am.
65 present असतील तर रिस्पॉन्स द्या. अदरवाइज लास्ट लेक्चर आहे तसंही रिमूव्ह केलं तरी एक प्रॅक्टिकल जाईल तुमची. Roll number 63 and 65. What is CVS? Lastly, 63 and 65. What is CVS? Sound is audible to all.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, it will be considered as absent. 61. Roll number 61. Roll number 60.
61, yes, madam.
What is CVS? 61. We are studying pharmacological actions, right? CVS वरती ऍक्शन आहे प्रोस्टाग्लॅन्डिनची म्हणजे काय कोणत्या सिस्टीम वरती 61. कोरे 59. Roll number 59. Are you present? Voice येतोय सगळ्यांना
Yes, ma'am. Yes, ma'am.
आणि 59 काहीतरी बोलतात त्यांचे तर ऐकायला की मलाच येत नाही फक्त. रोल नंबर 59. व्हॉट इज CVS? CVSच माहित नाही तर कशाला फार्माकोलॉजिकल ऍक्शन स्टडी करतात. किती अशा आहेत की ज्यांना CVS माहित नाही.
Cardiovascular system.
Cardiovascular.
Okay, so which action is observed on CVS? Vasodilation effect, therefore fall in BP. Then on bronchi, PGF2, it produces or it shows bronchoconstriction, and PGE2, it shows bronchodilation. Then next on smooth muscle, there is contraction of smooth muscle of uterus. जे uterus smooth muscle आहेत त्यांचं contraction होतं. Then next on GIT, decrease the acid secretion and increases the muscle secretion. म्हणजे GIT मध्ये काय होतंय acid secretion decrease करतात. Then next on intestinal muscle, it shows spasmogenic effect and increases peristalsis movement. Spasmogenic effect म्हणजे काय प्रॅक्टिकल मध्ये झालंय spasm, spasmogen, spasmogenic, spasmolytic. Yes or no? स्पाझमोजेनिक इफेक्ट झालाय की नाही? Sound is audible to all.
Yes, ma'am.
Spasmogenic effect झालाय की नाही?
Yes, ma'am.
Yes, ma'am.
So they show spasmogenic effect on the intestinal muscle and also increases peristalsis. Then next point, action on kidney. It shows diuretic effect. What is mean by diuretic?
Increase in flow of urine.
So on the kidney, they shows diuretic effect. That is prostaglandin shows diuretic effect. Then next point, action on ANS. It decreases release of adrenal medulla. Adrenal medulla मधून adrenaline release decrease करतात. Then which effect is observed? काय होईल? Decrease केलंय release. तर fall in BP or rise in BP?
Fall in BP.
Okay. Then next action on eye. Decrease intraocular tension or intraocular fluid in the eye. So this is about eye. Then next action on CNS. It produces pyrogenic fever by act as transmitter. ते mechanism आठवतं NSAID मध्ये सांगितलेलं pyrogen, how they goes into the CNS, prostaglandin, then they shows infection produce करतात. After that, it leads to hypothalamus. Then hypothalamus, it is an heat regulating center where they are affected and rise the temperature of body. So on CNS, it produces pyrogenic fever by act as a transmitter. सांगितलेलं का ते mechanism? आता जे रिवाइज केलं ते. Do you remember how fever is produced? सांगितलेलं की नाही? Sound is audible to all. Then last pharmacological action is it causes platelet aggregation, that is aggregation of platelets. This point already discussed in drugs acting on blood system. Then next point is adverse effect, nausea, vomiting, diarrhea, hypotension, chest pain, bronchoconstriction and uterine constriction, and last one is vaginal bleeding. These are the side effects of prostaglandin. Then last point is uses. It is used in treatment of glaucoma. It is an eye disorder. Then next point, it is used in treatment of peptic ulcer. It is used in induction of labor. That is, in pregnant woman, it is used for induction of labor during the delivery. And next one, it is used in abortion up to 7 weeks of pregnancy. So prostaglandin, it is also used in abortion up to the 7 weeks, that is second trimester in the pregnancy, and also it is used in opening of ductus arterius in neonates and fetus. This is about prostaglandin. Here we complete Autocoids chapter from their definition. Then next one, their classification. From their classification, histamine and prostaglandin, and in detail pharmacology of prostaglandin and histamine. Autocoid complete झालेला